their greatness, to empower millions of young people from all backgrounds, including here in Canada, to realize their greatest potential. And that's just one example of his many contributions. Prince Philip will be remembered as a champion for young people, a decorated naval officer, a dedicated philanthropist, and a constant in the life of Queen Elizabeth II. Le Prince Philippe était un époux, un père, un
Prince Philip was a
grand-père
husband,
et un
father, grandfather,
arrière-grand-père
and
bien-aimé.
great-grandfather who was well
Les
loved.
pensées et les pensées de tous
My
les
thoughts
Canadiens
and the thoughts of
accompagnent
all
la reine
Canadians
Elisabeth
are
II
with Queen
et tous les
Elizabeth
membres
II
de la
and
famille
all the
royale.
members of the royal family.
La hausse des cas de COVID-19 continue d'être
The
inquiétante.
rise in
Dans
COVID-19
plusieurs
cases
endroits au
continues to be
pays,
of
des
concern.
mesures plus strictes sont
In several
nécessaires
locations
pour
across the
freiner la
country,
propagation
stricter
du
measures are
virus.
necessary to halt the
Mercredi,
spread of the
lors
virus.
de notre 29e
On Wednesday,
rencontre des premiers
during our
ministres des
29th
provinces et des territoires,
meeting of First
j'ai
Ministers of
répété
the
aux premiers
provinces and
ministres
territories,
qu'ils peuvent
I
compter
repeated to the
sur le
premiers
soutien
that they
continu
can
du
count on the
gouvernement
continued
fédéral.
support of the federal
On est là
government.
pour tous les
We are
Canadiens.
there for all Canadians.
Si vous en avez besoin, il y a plusieurs programmes en place
And if
pour
you need
vous
help,
aider.
there are several
Si,
programs
par
to assist
exemple,
you.
vous devez manquer du
For
travail
example,
parce qu'un de vos jeunes
if you have to
enfants est
miss
malade
work because one of
ou
your
que
young
son
children
école est
is
fermée,
ill
vous
or
pourriez
their
être
school is
éligible à la
closed,
prestation
you may be
canadienne de
eligible
la
for the
relance
Canadian
économique pour
the Canada
prochain.
Recovery Caregiving
Si
Benefit.
vous êtes incapable de
If
travailler
you
parce
can't
que vous
work
êtes
because
malade
you're
ou
sick,
que vous devez vous
or because
isoler
you have to
en
isolate
raison de la
because of
COVID-19,
COVID-19,
vous pourriez être éligible à
you
la
may also
prestation
be
canadienne
eligible
de maladie
for
pour la
the
relance
Canada
économique. Ces
Economic Recovery
programmes
Benefit.
peuvent vous fournir de
These
l'aide
programs can
financière,
help you with
que vous
financial
soyez
assistance,
salarié ou
whether you are a
travailleur
salaried
indépendant.
worker or self-employed.
Alors, à toutes les mères et les pères de famille qui
So to
travaillent
all mothers
fort,
and
et aux
fathers
autres
who are working
personnes qui
hard,
ont
and to
besoin de
everybody
soutien,
else who needs support,
n'hésitez pas
don't
d'aller
hesitate.
sur le site
Go to the canada.ca/coronavirus
pour avoir
site
toute l'information
to get
sur
all the
nos
information you
différents
need on our
programmes.
various programs.
Il faut faire tout ce qu'on peut pour
We have to do
combattre cette
everything
troisième
possible to
vague.
fight this
Chaque
third wave.
effort compte,
Every effort
chaque
counts,
effort
and every
peut
effort
sauver des vies.
can save lives.
Right now, we're seeing more and more young people being admitted to hospital with COVID-19. So too young people. There are more contagious and more serious variants out there. Even if you're younger, you can get sick very, very quickly. Or you can give the virus to someone you love who can get very sick. I know you've already done so much and sacrificed so much, but we just need you to hang in there a little bit longer. And to people of every age, we still need your help. Together, we're going to get through this. Our path out of this pandemic is vaccines. So that's my number one focus. Vaccine delivery and rollout is something I talked about with the premiers on Wednesday. So far, we've delivered more than 10.5 million doses to the provinces and territories. And I know that they're working to get these shots into the arms of Canadians as fast as possible. This is a true team effort, especially now that we're in the ramp-up phase of the vaccine rollout. Every day, more grandparents and parents are sharing their vaccine selfies on family group chats. Every day, more Canadians are safer. Vaccines are saving lives. And that's why we're doing everything we can to get more and more doses to the front lines. Until the end of May, we're scheduled to receive 1 million doses a week of the Pfizer vaccine. In June, we'll have almost 2 million doses a week delivered from Pfizer alone. For Moderna, we'll be receiving 2 million doses in April and almost 3 million in May. And we're anticipating to receive over 7 million in June. What this all means is that by the end of June, we can expect to have received at least 44 million doses of COVID-19 vaccines from Pfizer, Moderna, and AstraZeneca. Our government is in close contact with all companies that have approved COVID-19 vaccines in Canada to get the latest information on shipment schedules and amounts. Everyone is working around the clock to make sure Canadians are safe. This is true on vaccines and is true on a whole range of other things people need to stay healthy. On that front, I can confirm that we are extending the support of the Canadian Red Cross until the end of September for up to 27 long-term care and retirement homes in Ontario as necessary. The Red Cross will continue to help each home with their individual needs while supporting better infection prevention and control measures. Every senior deserves to be safe and to live in dignity, and we'll always be there for the residents of long-term care homes and their hardworking staff. To all of the Canadian Red Cross employees and volunteers, and to everyone at the Government Operations Centre who helps coordinate these deployments, thank you. You are doing incredible work. On espère tous que la pandémie sera bientôt derrière nous.
We all hope that the
Ce
pandemic
matin,
will be
on
behind
a
us
appris
soon.
que 303
This morning,
000
we learned
emplois
that
se sont ajoutés à
303,000
l'économie
jobs have been
canadienne
added to the
pendant le mois
Canadian
de
economy
mars,
during the
ce
month
qui
of
comprend
March.
des emplois
This
à
includes
temps plein
both
et
full-time
à temps
and part-time
partiel.
jobs.
Le taux de chômage est tombé à son
Unemployment has
plus
fallen
bas
to its lowest
depuis
level
février
since
de l'année
last
passée.
February.
C'est une nouvelle encourageante.
This
Mais
is
il reste
encouraging
encore
news,
beaucoup de travail à
but a
faire.
lot of work remains to
On
be
sait que
done.
plusieurs personnes sont encore
We know
sans
that several
emploi ou
people
ont des
still are
heures
jobless
réduites,
or are
d'autant
working
plus
reduced
que
hours,
de nouvelles
all the
restrictions
more so
sont
with
mises
new
en place à
restrictions
travers le
that are
pays.
being implemented across
We
the
will
country.
continue to be there for families, workers, and small businesses. For those who need support, we've created the Canada Recovery Benefit, and we've strengthened employment insurance. For hard-hit businesses, we have measures in place that you can count on, like the wage subsidy and the Canada Emergency Business Account. Of course, there's also the Canada Emergency Rent Subsidy that can help your business or organization directly, including with additional supports if you're affected by lockdowns. As I've said from the start, we'll be here with the support you need. On that note, on April 19th, we will present our 2021 budget. We'll continue to focus on our plan to keep Canadians safe and healthy. We'll also share more about our plan to create good middle-class jobs so we can rebuild an economy that works for everyone. The pandemic has highlighted and worsened far too many gaps in our society. That's something we'll keep working on to address. And as we do, we'll continue to stand up for what matters to Canadians, whether that's finding a good, well-paying job, staying healthy, or having our kids breathe clean air. These are your priorities, so they're our priorities too, and they're priorities on which we will continue to deliver. As we've seen over the past year, it's vital that we all work together to get through this crisis. So that's why I'll be inviting all party leaders to meet individually with me to discuss the upcoming budget early next week. Avant de terminer, je veux encore remercier tout le
Before
monde qui fait
closing,
des efforts
I would
pour
like to
aider
thank
à
everybody
lutter contre la
again, all of
pandémie.
those people who are
Que ce
making
soit les
efforts to
travailleurs de
fight
la
this
santé
pandemic,
qui sont
whether we're talking
fatigués
about the
et qui
healthcare workers
s'inquiètent de
who are
leurs patients,
tired and who
les
are so worried
travailleurs
about their
essentiels qui sont
patients,
toujours au
essential
poste
workers
malgré
who
les
are
risques
still on the
d'attraper
job
le
despite the risks
virus,
of catching the
ou tous les
virus,
gens à la
or
maison
all
qui
of the
font
people at
attention
home
et qui
who are being
respectent les
careful and who
consignes
are
de santé
respecting the
publique.
public health instructions.
Merci
Thank
et
you,
on lâche pas.
and let's not
Il
give
y a de
up.
plus en plus de gens
There are
vaccinés
more and more people
et
who are
ensemble,
vaccinated now.
on va passer à
Together,
travers.
we can get through
Merci.
this.
Je
Thank
passe
you.
maintenant la parole
And now I'd
à
like
la
to turn the
docteure
floor over to
Tan.
Dr. Tan.
Teresa.
Bonjour à toutes et à tous.
Hello, everybody.
Today, we'll provide an update on current numbers and trends, as well as developments on the vaccine front. The race between vaccines and variants is at a critical point. The modeling prediction from 2 weeks ago that forecasts a resurgence is playing out in the data we are seeing now, with case counts plotting along the strong resurgence trajectory. It is clear that we need stronger control to combat variants of concern that are driving rapid epidemic growth in many areas of the country. To date, over 1,036,000 cases of COVID-19, including 23,200 deaths, have been reported in Canada. Over the past week, there have been an average of over 6,800 new cases and 30 deaths reported daily, and the number of people experiencing severe and critical illness continues to rise. Last week, an average of over 2,500 people with COVID-19 were being treated in our hospitals each day, representing a 7% increase over the previous week. 860 of these people were being treated in intensive care units. which is 23% higher than the last week. The increasing predominance of variants of concern is the major contributing factor to these worrying trends, resulting in accelerated spread and more severe illness, including among younger and previously healthy adults. Over the past week, the number of new variant cases has more than doubled. To date, almost 25,000 variants of concern cases have been reported across Canada, with B.1.1.7 variant continuing to account for over 90%. All of these trends tell us that, even as vaccines are bringing us closer to end this crisis, we cannot afford to give this virus an inch. In areas with epidemic growth, the only way to get out of this crisis is the hard way, by staying home as much as we can and consistently maintaining our distance and wearing a mask when we must go out. Several jurisdictions have tightened restrictions to control rapid spread, but let's remember that essential workers will still be there, providing the vital supplies, care, and support we need. With gratitude, let's commit to doing everything we can to protect them by staying home whenever we can. On the vaccine side of the race, it's been another busy week. Supplies continue to increase, with over 10 million doses of COVID-19 vaccines distributed across the country to date. Provinces and territories have administered more than 7 million doses and are further expanding programs as the supply ramps up. Our experts and regulatory authorities have also been busy, ensuring that vaccinations are optimized for use in the Canadian context and engaging with international partners on the in-depth review of vaccine safety data. This week, Health Canada attended the European Medicine Agency's Safety Committee meeting regarding the recent safety signal linked to the AstraZeneca vaccine. The European Medicines Agency, or EMA, has reviewed all currently available evidence and considered the risk of hospitalization and death due to COVID-19 against the very rare occurrence of combined blood clots and low blood platelets, known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. There may be another name for this clinical entity coming out soon as well. Their assessment concluded that while there is a possible link between the AstraZeneca vaccine and this very rare blood clotting disorder, the overall benefits of the vaccine in preventing COVID-19 and its severe outcomes outweigh the risk of side effects. Last week, Canadian jurisdictions took the precautionary measure to pause the use of AstraZeneca vaccine in people under age 55, and to date, no cases of VIPIT have been reported in Canada. Health Canada will consider the latest evidence presented by the EMA, together with information being provided by AstraZeneca, to decide whether any changes are needed to the Canadian product label. The National Advisory Committee on Immunization will also review its recommendation in light of any new data in support of the provincial and territorial program decisions. Canada's health leaders are committed to working together, adapting approaches as the science and situation evolves, and keeping Canadians safe, healthy, and informed. We are getting closer every day, and we're more united and stronger for it. Thank you.
Bonjour à toutes et à tous. Aujourd'hui,
Hello,
nous
everybody.
présentons une mise à
Today,
jour
we'll be
sur les
presenting an
données et les
update
tendances
of the
actuelles
current
ainsi que
trends
sur
and
les
data
développements
and
relatifs à
recent
la
developments
vaccination.
regarding
La course
vaccination.
entre les vaccins et les
The race to
variants
vaccines
est à un point
and the
critique.
variants
La
is at a fateful
modélisation
point.
d'il y a 2
The
semaines
modeling of 2
qui
weeks ago
prédisait une
that had
recrudescence
forecasted
est
a
démontrée dans les données
resurgence
que nous
has been
recevons
demonstrated in the
maintenant.
data we're seeing
Le nombre
now,
de cas suivants sur la trajectoire liée à une forte
with case counts
recrudescence, il
plotting
est
along
clair
the
que nous
strong
devons
resurgence
exercer
trajectory.
un contrôle
It is clear
renforcé
that we
pour
need
lutter
stronger
contre les
control to
variants
combat
préoccupants
variants of
qui
concern,
stimulent la croissance
the variants that are
épidémique
driving
rapide
rapid
dans de
epidemic
nombreuses
growth in
régions
many
du
areas
pays.
of the country.
À ce jour, plus de 1
To date,
36
over
000 cas de COVID-19,
1,036,000
dont
cases of
23
COVID-19,
200
including
décès, ont été
23,200
recensés au
deaths,
Canada.
have been
Au
reported in
cours de la
Canada.
dernière semaine, plus de 6
In the last
800
week,
nouveaux cas et
over
30 décès ont
6,800 new
été
cases and
signalés
30
en
deaths have
moyenne
been
chaque
reported
jour et le nombre de cas
daily
graves
on
et
average,
critiques
and the number
de
of
la
people
maladie
experiencing
continue
severe and
d'augmenter.
critical illness
La
continues to
semaine
rise.
dernière, Une moyenne de plus de
Last week,
2500
an average of over
personnes atteintes de la
2,500 people with
COVID-19 ont
COVID-19 were
été
being
traitées dans
treated
nos
in our
hôpitaux chaque
hospitals
jour,
every day.
soit une augmentation de
This represents a
7% par
7%
rapport à la
increase over
semaine
the previous
précédente.
week.
De ce nombre, 860
Of this
personnes
number,
étaient dans les unités
860
de
people
soins
were being
intensifs,
treated in
ce
intensive
qui
care units,
représente une augmentation
which is
de
an increase of
23%
23%
par
over
rapport à la
last
semaine
week.
dernière. La prédominance grandissante des
The
variants
increasing
préoccupants
predominance of variants of
constitue le
concern is the
principal
major
facteur qui
contributing factor
favorise
to these
ces
worrying
tendances
trends,
inquiétantes, ce qui cause une vitesse de propagation rapide
which are
et des
causing
cas plus graves
accelerated
de la
spread and
maladie,
more
y
severe illness,
compris chez
including
les jeunes
among
adultes
younger
auparavant
and previously
en
healthy
santé.
adults.
Au cours de la dernière semaine, le nombre de cas de
Over the
nouveaux
last
variants
week,
a
the
plus
number
que
of new
doublé.
variant cases has more
À
than
ce jour,
doubled.
presque 25 000
To
cas de
date,
variants
nearly
préoccupants ont été
25,000
signalés au
variant of concern
Canada.
cases have
Le
been
variant
reported in Canada,
B117
with the
continuant
B117
d'être
variant continuing
responsable
to
de plus de
account for over
90% des
90%
cas.
of cases.
Toutes ces tendances nous indiquent que même si la
All of these
vaccination
trends tell us
nous
that
rapproche de la
even
fin de
as
cette crise,
vaccines are bringing
nous
us
ne pouvons
closer
pas
to the
nous
end of this
permettre
crisis,
de laisser
we cannot
rien
afford
passer.
to
Dans les
let
régions où
anything
l'épidémie
slip.
va en
In
augmentant,
areas with
la
epidemic
seule
growth,
façon
the
de
only way to get
sortir
out of this
de cette
crisis
crise
is
devra
the
se faire
hard way.
en appliquant des mesures rigoureuses, en restant à la
We'll
maison
have
le
to stay
plus
home as
possible,
much as we can
en maintenant constamment
and
nos distances
consistently
et en
maintain our
portant un
distance
masque lorsque
and
nous
wear a
devons
mask when we
sortir.
must go out.
Plusieurs administrations ont renforcé
Several
leurs
jurisdictions have tightened
restrictions pour
restrictions to
contrôler la
control rapid
propagation
spread.
rapide. Mais rappelons-nous que les
But let's
travailleurs
remember,
essentiels
essential
seront
workers
toujours là
will
pour
still be
fournir les
there,
biens essentiels,
providing vital
les soins
supplies,
et le
care,
soutien
and
dont nous
supports
avons
which we
besoin.
need.
Démontrons notre gratitude,
Let's commit to
engageons-nous
showing
à
our
faire tout ce
gratitude
que
by doing
nous
everything that
pouvons
we
pour les
can to protect
protéger
them
en
by
restant à
staying
la
home
maison
whenever we
le
can.
plus possible. Sur le plan de la course avec les vaccins, la
On
semaine
the
a encore
vaccine
été
side of the
occupée.
race, it's been another
Les
busy
stocks
week.
continuent d'augmenter
Supplies are
avec
continuing to
plus de 10
increase,
millions de
with
doses de
over 10
vaccins
million
contre la
doses of
COVID-19
COVID-19
qui ont
vaccines
été
being
distribuées
distributed
partout
across
au
the
pays
country to
à ce
date.
jour. Les provinces et les territoires ont
Provinces and
administré plus de
territories
7
have
millions de
administered more
doses
than
et
7 million
continuent
doses and
d'exécuter
are further
des programmes de
expanding programs
vaccination à
as the
mesure
supply
que nous
ramps
sommes
up.
approvisionnés. Nos experts et les autorités
Our
réglementaires
expert
ont
and
également été
regulatory
occupés.
authorities have
Ils
also
se
been
sont
busy.
assurés que les campagnes
They
de
have been ensuring that
vaccination soient
vaccinations are
optimisées
optimized
dans
for
le
use in the
contexte
Canadian
canadien et
context
se sont
and
mobilisés
engaging
avec les
with international
partenaires
partners on the
internationaux
in-depth
pour
review
effectuer
of
un
vaccine
examen
safety data.
approfondi des données probantes sur l'innocuité des vaccins. Cette semaine, Santé Canada
This
a
week, Health
participé à la
Canada
rencontre
attended
du
the
comité
European
sur
Medicines
l'innocuité de
Agency's
l'Agence
Safety Committee
européenne
meeting.
des médicaments, ou AEM,
The European
concernant
Medicines
le
Agency
récent
is also
avis
called the
lancé contre la
EMA. The
sécurité du
meeting was
vaccin
regarding the recent
d'AstraZeneca.
safety signal
Le
linked to the AstraZeneca
AEM a
vaccine.
examiné toutes les données
The EMA
probantes
has reviewed
actuellement
all currently
disponibles
available
et a
evidence
étudié
and
le
considered the
risque
risk of
d'hospitalisation
hospitalization
et de
and death
décès
due to
découlant de la
COVID-19
COVID-19
and
et de
compared this
l'occurrence
against
très
the
rare
very
des
rare
caillots
occurrence of
sanguins et
combined
de
blood
faible
clots and
nombre
low
de
blood
plaquettes,
platelets,
phénomène connu
as
sous le nom de thrombocytopénie
vaccine-induced
immunitaire
prothrombotic
prothrombotique
immune
induite par un vaccin,
thrombocytopenia,
ou TPIV.
or
Cet
DIPIT.
organisme a conclu que, malgré qu'il existe un lien entre le
Their
vaccin
assessment concluded that while
d'AstraZeneca
there is a
et ce
possible link
trouble
between the
très rare des
AstraZeneca
caillots
vaccine
sanguins,
and this very
les
rare blood
avantages
clotting
généraux du
disorder,
vaccin
the
pour
overall
prévenir la
benefits of the
COVID-19
vaccine in
et ses
preventing
graves
COVID-19
complications
and its severe
l'emportent sur
outcomes
les risques
outweigh the
d'effets
risks of side
secondaires.
effects.
La semaine dernière, les administrations
Last
canadiennes
week, Canadian
ont pris la mesure
jurisdictions
de
took the
précaution de
precautionary
suspendre
measure to
l'utilisation du
pause the
vaccin
use of the AstraZeneca
d'AstraZeneca
vaccine
chez les
in
personnes de
people
moins de
under
55 ans.
55.
À ce jour, aucun cas de
To
TPIV n'a
date,
été
no
signalé
cases
au
of DIPIT
Canada.
have been reported in
Santé
Canada.
Canada examinera les dernières données
Health
probantes
Canada will
présentées
consider
par
the latest
le
evidence
AEM
presented by the
de pair avec les
EMA, together
renseignements
with
fournis par
information being provided
AstraZeneca
by
pour
AstraZeneca,
décider si des
to determine
changements
whether any
doivent être
changes are needed
apportés
to the
à
Canadian
l'étiquetage
product
de ce
label.
produit au Canada. Le Comité consultatif national de l'immunisation
The
examinera
National Advisory
également
Committee on
sa
Immunization will
recommandation
also review
à
its
la lumière
recommendation
de
in light
toutes les
of any
nouvelles
new
données
data in
à
support of
l'appui des
provincial and
décisions prises
territorial
dans le cadre
program
des programmes
decisions.
provinciaux et territoriaux. Les chefs de file en santé du Canada
Canada's health
sont
leaders
résolus
are
à
committed
travailler
to working
ensemble,
together
adaptant des
to
approches et
adapting
mesures que la
approaches
science
as
et
the
la
science and
situation
situation
évoluent
evolves,
et à
and to
maintenir
keeping
les
Canadians
Canadiens en
safe,
sécurité, en santé
safe,
et
healthy, and
informés.
informed.
Nous nous rapprochons du but, mais chaque jour,
We're getting
et
closer
nous
to the
sommes
goal
plus
every
unis
day,
et plus
and we're
forts
more
à cette
united
fin.
and stronger for
Merci.
it. Thank you.
Thank you, doctors. We'll now go to questions from media. We'll start on the phone. Over to you, operator.
Thank you.
Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question.
Press star 1 now if you have a question.
Our first question is from Anna Thibodeau from CBC National News. Please go ahead. À vous la parole.
Good morning. Thank you for taking our questions. Prime Minister, clearly some provinces are struggling to respond to rising infections, hospitalizations, even deaths, and we know you've offered to help the provinces if they ask for it. But I think as Canadians sit at home and see these record-rising numbers in places like BC, Quebec, and Ontario, they might be saying, is it not time that you tell the provinces you're stepping in?
Thank you for your question. I can understand the frustration, the anxiety, the concern that Canadians right across the country are feeling at seeing these numbers rise. I share it. I think we're all recognizing that we don't want to be in this third wave, but we're here. And as we've been doing from the very beginning, we've been working very closely with the provinces and territories to ensure that they have the supports necessary to make the right decisions for their jurisdictions. The caseload and the trajectory isn't the same right across the country. And what we've done as a federal government is stepped up so anywhere across the country, if there is a shutdown, if public health orders require people to stay home and they can't go to work, if small businesses are affected, our federal supports are there. Whether it is direct income support for workers who've been laid off, support for small businesses through the wage subsidy or through the CEBA business account or through the rent subsidy with a top-up for lockdowns, whether it was direct support of well over $19 billion we sent to the provinces and territories to help them managing their healthcare systems, dealing with rapid testing, dealing with vaccinations. We will continue to be there to work hand in hand and respect the provinces as they make the right decisions for their jurisdictions.
Follow up, Hannah?
Oh, yes, please. Thank you. Okay, so I take that as a no, that you don't feel you have to step in. And I want to move on to federal supports. So given how hard this third wave is hitting some communities, is there anything more you can do to encourage workers to stay at home when sick? Could you increase the amount or make a tax rebate for companies?
We have brought in the Canada Sickness Benefit to make sure that if people start seeing symptoms or they're required to self-isolate, they can collect support from the government while staying at home so they can keep putting food on the table, so they can keep paying their rent, even if they're staying home to protect their loved ones and their community. There are many measures that this government has put in. We're always open to more, but I will highlight that we've already, when we designed most of these measures, built in natural or responsive adjustments to make sure that as future waves could hit, as we see right now, those systems would be in place and would adjust to be there to help the most vulnerable. We've already extended them to the summer, and we will continue to watch very closely to see if there's more we need to do or if we need to extend them even longer. We made a promise to Canadians that we'd have their backs. That's exactly what we're going to do for as long as it takes, with as much as it takes.
Thank you. Next question, operator.
Thank you. Our next question is from Marieke Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good morning. Thank you so much for taking our questions. Prime Minister, you'll be speaking at your convention, your party's convention tomorrow, but tonight we're hearing from Mark Carney. Are you hoping he'll run as a Liberal candidate in the next election?
The Liberal Party has a long history of welcoming in expert speakers at our conventions on from a range of different backgrounds. we're very pleased to have someone of the stature of Mark Carney, who's been working very, very hard on, among other things, the intersection between the global economy and the fight against climate change. I know Liberals are very excited to hear what he has to say, and it's just another example of how we work together to listen to experts and the best and the brightest from around the world as we look at how to continue to focus on getting Canadians through this pandemic and on building back better.
Follow up, Marika?
And last night, thank you. Yeah, last night, Deputy Prime Minister Chrystia Freeland again made it clear how much of a priority some sort of national childcare program is for her. The issue has gotten a lot more attention under your government since she took on her new position as finance minister last year. I'm wondering if you can tell us your perspective on what you believe a national childcare program should look like in Canada.
I know people are very much looking forward to the budget on April 19th, in which we will share our perspective on how to grow the economy, how to create jobs, how to support Canadians, how to make sure that the middle class and people working hard to join it comes through this pandemic and our economy comes roaring back. The Liberal Party has been talking about childcare for a long time, and indeed, over the past 5 years, we've transferred billions of dollars to the provinces to improve childcare across the country. But we know, and this pandemic has certainly highlighted, that there is more to do. What we're seeing is that people have finally understood what the Liberal Party has long known, that childcare is not simply a social argument or a social program. It's fundamentally an economic program, getting more women into the workforce, allowing families to not have to make impossible choices between having another child or staying in the workforce. These are things that are good for the economy, and the business community right across the country has spoken up clearly and strongly in support of something that families and indeed women across this country have known for a long time. Childcare is something we need to do as a country.
Merci. Prochaine question. Operator.
Thank you. Notre prochaine question nous vient de Geneviève Normand de Radio-Canada.
Next question from Geneviève Normand from Radio-Canada. Go ahead.
Oui, bonjour. Je vous lance ma question
Yes.
à tous
My
les deux,
question is for
Monsieur
both
Leblanc
of
et
you,
Monsieur Trudeau.
Mrs.
Êtes-vous
Leblanc
capable de
and
penser à
Trudeau.
un souvenir avec le prince Philippe?
Do you have
Et
any
êtes-vous
memory of
capable
Prince
d'élaborer
Philip?
peut-être
And
sur les liens
could you say
vous, le
more about
Canada,
any
avez entretenus
links that
avec le
you,
mari de la
Canada,
reine au
have
cours des
with the
dernières
Queen's
années,
consort
des
in
dernières
recent
décennies?
years or decades?
Certainement, c'est avec une
Of
grande
course,
tristesse
it is with
qu'on a
great
appris
sorrow that we learned
de la mort du
of the
prince
death
Philippe.
of Prince
C'est
Philip.
quelqu'un que j'ai connu toute ma vie.
He's
Les
somebody that
premières
I've
fois
known
que
my
je l'ai
whole life.
rencontré,
The first times I met him,
un jeune enfant
I was a
ici à
little
Ottawa.
child here in Ottawa.
Mes meilleurs souvenirs sont des conversations
My best
que j'ai eues
memories were
avec
conversations that I had
depuis plusieurs années, notamment
several years ago,
lors de la rencontre du
including
Commonwealth
during the
à
Commonwealth
Malte,
meeting in Malta.
dans mes premiers mois en tant
In
que
my
Premier
first
ministre.
months as Prime Minister.
C'est un homme fascinant.
He was a fascinating man who has always been devoted to service
à la reine.
and to the Queen.
Et nous le regrettons profondément avec son
We are
passage.
very, very sorry to hear of his death.
I have known, had the privilege of knowing Prince Philip almost my entire life. The first times I met him, I was just a kid here in Ottawa many years ago. But obviously, over the past few years, I've had the opportunity to have a few more conversations with him. And it is a tremendous personal as well as public sorrow that we all share at his passing. In Malta a few years ago, actually a few months after becoming Prime Minister for the first time, I was able to have a number of wonderful conversations with him, and he is going to be sorely missed, not just by his family, but obviously by all of us. Dominic?
Merci, Monsieur le Premier ministre. Moi aussi,
Thank you,
je partage la
Prime
tristesse
Minister.
de tous
I
les
also
Canadiens quand
share
on a
the
appris ce
sorrow of all
matin le
Canadians
décès
when we learned
de
this
Son
morning
Altesse Royale.
of
Le
His
Premier
Royal
ministre a bien
Highness.
souligné le service
The
incroyable
Prime
qu'il
Minister
a
has
rendu
referred to the incredible service that he provided over so many years and decades. His devotion to the Queen as well, I believe, has touched millions of people across the globe. I remember spending an informal evening. It was literally a barbecue on Canada Day. I'm trying to remember whether it was in 1997 or 98. Her Majesty and the Prince were in Ottawa. My father was Governor General. And there was a free evening, and Her Majesty suggested an informal barbecue, just two tables of 8 people, and it was my good fortune to be seated with Prince Philip. As the Prime Minister I was touched by his knowledge of Canada and the way that he talked about the service of young people and how he had devoted so much time to this cause.
And in English, please.
I share the Prime Minister's comments, obviously, with respect to the sad news we learned this morning, the sad news that affected all Canadians with the passing of His Royal Highness Prince Philip, the Duke of Edinburgh. I, like the Prime Minister, have a particular memory of having spoken with him 25 years ago, probably, at an informal barbecue that Her Majesty had suggested be organized at Rideau Hall when they were in Ottawa for Canada Day. They had a free evening, and Her Majesty suggested that perhaps a summer barbecue. There were only 2 tables of 8 people at the dinner, and I had the chance to sit at Prince Philip's table and remember fondly his knowledge of Canada, his interest in Canadians and in Canada, but the passion with which he spoke about his service to young people. That is a memory I will always cherish.
Yes, Sophie. Geneviève. Okay, we'll turn to the room.
Canadian Press. Thanks, Prime Minister. Have you asked Mark Carney to run as a Liberal in the next federal election, or are you trying to persuade him to?
As I said, Liberal conventions are always an opportunity to gather as Liberals and reflect on the ideas that can push Canada forward, that we will continue to discuss and debate between elections and building a platform. One of the things that we've always done is brought in strong voices who contribute to our reflections, sometimes partisan, sometimes independent, but always they feed the discussions that we have, and I'm very pleased someone with the expertise, particularly in the combination of economy and environment that work together, that is something that the Liberal Party has always stood for, and I look forward to seeing Mark's speech tonight.
Thank you. And I'm going to note you didn't answer the question, Prime Minister. On the universal basic income, you in the past have expressed that now is not the time to create or introduce a universal basic income. Members of your caucus obviously feel differently. Have you changed your mind, or is now still not the time to introduce a universal basic income, or do you feel differently?
I think one of the great things about Liberal conventions is people put forward strong and challenging ideas that get debated and discussed and looked at by people from right across the country. I think it's a wonderful opportunity. We know in the past that challenging proposals brought on the floor of the Liberal Convention made it into policy and have shaped Canada over the past number of years. So I'm not going to comment on any specific resolutions, but I know that what Liberals are going to do this weekend is talk about a wide range of great ideas that will help move Canada forward. What they won't be doing this weekend is debating about whether climate change is real. That debate is settled for Canadians.
Prime Minister, Mike Lucatore with Global National. Dr. Tam just said, quote, "It's clear we need stronger controls in place." Your government can do more, and I just wanted to ask you, in the past, you have not hesitated from calling out premiers on climate change and their lack of action on it. So I just want to know why you're so hesitant to call them out for not getting shots into arms quicker.
I think one of the things that we've seen from the beginning of this pandemic, Mike, is the Canadians have been reassured by the fact that different orders of government are working together. And that has been something that is both reassuring, but also confidence building in a population that is rightly anxious about the path of COVID-19. Provinces and the federal government have worked together through this pandemic, whether it's been federal investments to support the provinces in healthcare, in rapid testing, in PPE, and now the federal government paying for vaccines that are being administered by the provinces. We are there to support them as they need to get vaccines in arms. And quite frankly, this has been something that we've worked on together over the past many, many months. We will continue to be there, and the provinces have just as much of a priority as everyone else to vaccinate as many people as possible, as quickly as possible, and that's what Canadians expect.
I just want to follow up on vaccines, and there's been criticism in the past for not getting more vaccines in the country sooner, and I know that you just mentioned that there will be 44 million by June, but do you think it was a mistake not to push the manufacturers to have more precise deadlines rather than just on specific, or I shouldn't say even on specific, just to have them delivered by a certain quarter? Would you not have preferred to have them A, earlier, and B, a more specific timeline for them to be in the country?
I think obviously we would have loved to have more vaccines much quicker, but let's remember, and I'll turn to Minister Anand for a follow-up on this, let's remember that there were no vaccines around against COVID-19 a year ago. These are brand new developments that the scientific community, the international community, experts have worked on incredibly hard over the past many months. And we are unbelievably lucky as humans that we have collectively been able to develop not just one effective vaccine against this virus, but many effective vaccines. But the challenge of developing a safe and effective vaccine is one. The second challenge is producing that vaccine at a scale that is going to make a difference around the world. And pharmaceutical companies and indeed countries around the world have stepped up to contribute to make sure that we are producing as many as possible and getting them out to people around the world. So we had commitments for 6 million vaccine doses arrived in Canada by the end of March. We blew through that target and got more. And over the coming weeks, we're going to be getting even more vaccines in. The end is definitely in sight, but we're not there yet. This third wave is more serious, and we need to hang in there for another few weeks to make sure that we can flatten that curve, drop those numbers down again, to give a chance for vaccines to take hold and to allow us to get to what will hopefully be a much more normal summer by the time the weather turns really nice. Anita.
Thank you so much, Prime Minister. At the time of contracting, we did not know whether a vaccine would be produced and when. We did not know the time of regulatory approval. And that goes for the vaccine suppliers themselves. As a result, the suppliers were reluctant, indeed refused to provide anything more than a quarterly delivery schedule. They would not provide weekly delivery schedules because of the fact that there was no vaccine in existence. As the Prime Minister mentioned, we began the quarter with 6 million vaccines targeted to come into the country. We ended March with 9.5 million vaccines in the country. We are accelerating rapidly in terms of our deliveries. We will see Q2 looking very different from Q1. For example, 6 million doses will be arriving in April. 7 million doses will be arriving in May, with 44 million overall prior to the end of June. Right now, 17%
of Canadians have received at least one dose of vaccine. Canada stands 7th in the G20 in terms of doses administered per 100 people. As we have repeatedly said, our vaccine procurements and deliveries are rapidly accelerating. We have moved 22 million doses from later quarters to earlier quarters in the year, including, as I mentioned, 44 million doses expected prior to the end of June. We will keep working every single day with our suppliers to aggressively push them to deliver more doses earlier and earlier to Canadians. That's our government's priority, and that's what we'll keep working on. Thank you.
Prime Minister Krista Nashkate, CTV National News. This question is for you, but also Minister Anand. Dr. Fauci has said that even if AstraZeneca gets approved, there is no plan to use the vaccine in the U.S. The Americans will soon have 90 million doses of AstraZeneca made and sitting unused in storage. But Canada has only received 1.5 million AstraZeneca doses from the US. Why haven't you been able to get more of those unused doses into Canada?
We continue our discussions with the American administration on getting more doses into Canada. We understand that they made the decision around vaccinating Americans first, particularly under the previous administration, but that continues under this one. We will keep working with them and ensure that we get more doses as soon as we can.
I might just add to the Prime Minister's comments that we, in our contracting, were deliberate in terms of ensuring that we could pull vaccine from many geographical locations in the world, the United States included. But at the current time, please note that we are pulling vaccine from Europe, from India, from South Korea, and from the United States. AstraZeneca in particular is one vaccine that we are ensuring we have a diversified source of supply from multiple locations. In terms of continuing to bring supply in from the United States, let's just remember that it's as a result of our contract for 20 million doses of AstraZeneca to be produced in the United States that we were able to do the exchange agreement with the United States so that when we have that 1.5 million doses in the country, which arrived last week, we will then return 1.5 million back to the United States. That's a very good model for additional deliveries into Canada. We are continuing to discuss this possibility with the U.S. administration, including through the excellent work of our ambassador, Kirsten Hillman. Thank you.
And thank you. And this next question is for Dr. Tam or Dr. New. The European Medicines Agency has said they've started a probe into the Johnson & Johnson vaccine due to reports of the same blood clotting issues that have impacted AstraZeneca. What info does Health Canada have about this right now?
This is Teresa Tam. I can't speak directly to exactly what the regulator has. I'm not from that area, but I know that as per the clotting and low platelets issue related to the AstraZeneca vaccine, Health Canada is connected with all of its international counterparts, including the FDA. Of course, the EMA that has been investigating the AstraZeneca vaccine as well. It was always an area of increased vigilance and further inquiries because, as you may already have appreciated, the J&J vaccine or Janssen is the same type of vaccine, the viral vector vaccine, as the AstraZeneca vaccine. So with all due diligence, people have been actively looking for some of these similar cases with the J&J. So we're just beginning to see that coming through with the reporting. But I think as with the previous process, Health Canada will do their work. And then as needed, based on the information available, the National Advisory Committee on Immunizations and others will also be completed their work as they did with the AstraZeneca vaccine.
Thank you, Doctor. We'll now return to the phone with one follow-up question. Operator.
Thank you. We have a question. Notre prochaine question est de Geneviève Normand de Radio-Canada. À vous la parole.
Geneviève
Please
Normand,
go ahead.
Radio-Canada, go ahead.
Oui, merci de prendre ma question.
Thank you for taking my follow-up question.
Congrès, qui s'en vient,
It's about the convention that's coming up. Several resolutions are going to be debated at the convention, and they are quite a bit similar to those that are no longer the NDP. For example, guaranteed minimum income, guaranteed universal basic income. How can you be sure that you really have the best electoral process? Well, our priority now, as a government, as a Liberal Party, is to ensure that we are protecting Canadians from the coronavirus, and we are building back better. Obviously, Liberal activists will be discussing all kinds of different issues so as to improve and contribute and help Canadians to build a better future. That's what we always do in parties' conventions. And I'm looking forward to hearing the deliberations and seeing how these will influence our vision for a better future for Canadians, for the middle class, for people who are working so hard to join. But in all of our conversations this weekend on all kinds of subjects, I can assure you of one thing. There will be no debate about whether climate change is real or not, because for the Liberals, this issue is clear.
Thank you. That concludes the time the Prime Minister has for questions. The doctors and the ministers will be around for a little bit longer, and we'll start on the phone once the Prime Minister has left the room.
During this uncertain time, we're doing our part. Our financial centers may be closed for in-person meetings, but our dedicated financial advisors are adapting to the new reality of virtual and electronic business, focusing on what they do best, listening and providing professional advice to you, their clients. Our more than 700 financial advisors across Canada have been working tirelessly to respond to your questions and concerns. Being proactive and committed, they aim to bring a sense of confidence and security in your financial future, despite the circumstances. Our financial advisors are here for you, now more than ever. From all of us at Desjardins Financial Security Independent Network, stay safe and healthy.